Today we will be performing a musculoskeletal assessment. I'm going to knock on the patient's door. I'm going to come in, perform hand hygiene. I'm going to introduce myself to the patient and explain what we're doing. Hi, can I have your name and date of birth?
Christina Cook, 1191.
All right, my name is Carla. Is it okay if we perform a musculoskeletal assessment on you today?
Sure.
All right. So the first thing that I'm going to be doing is I'm going to look overall at symmetry, and I'm also going to assess your extremities for alignment, and I'm going to ask you to walk forward and back so I can assess your gait. So I'm looking to make sure that nothing is uneven. Her gait is symmetrical. All right, thank you. The next thing I'm going to do is I'm going to assess your temporomandibular joint. So I'm going to go ahead and palpate here. And any pain? No. All right, go ahead and open and close. Good. So I'm listening for any clicks or abnormal sounds, and I don't hear anything. Was there any pain with opening and closing your mouth? No. Okay. I'm also going to have you move your jaw from side to side. Good. And I'm going to have you retract it. And I'm also going to have you protrude it and bring it forward. Very good. All right, the next thing I'm going to do is I'm going to assess your neck, looking for any symmetry. And then I'm also going to palpate it. I'm sorry, my hands are a little cold. I'm going to palpate for muscle tone. So I'm just feeling through here. And the next thing that I'm going to do is assess for range of motion in your neck. So as we go through in a head-to-toe fashion, we're going to be inspecting, we're going to be assessing, palpating, assessing range of motion, and strength. So for range of motion for your neck, I'm going to have you do flexion, which is bringing your neck forward. And then I'm going to have you do hyperextension, which is bringing your neck back. Lateral bending, side to side, and then rotating it. Okay? The next thing we're going to do is assess for strength. So I'm going to put my hand on this side of your face, and I'm going to have you push your neck towards my hand. Good. And this side as well. It's important to assess both left and right so you can assess for symmetry. The next thing I'm going to do is I'm going to assess your spine. I'm going to look at the cervical spine, thoracic, and lumbar spine for alignment and symmetry. And then we're also, so go ahead and I'm going to have you turn. All right. And then next I'm going to have you assess for range of motion in your back. So you can, I'm going to have you face me again, and I'm going to have you do these exercises. So flexion of the spine is going to be moving forward like this. So come forward, good. And then hyperextension is going to be coming back. Very good. Lateral bending is going to be moving from side to side. And then rotation of the spine is going to be moving like this. Very good. Now I'm going to have you turn, and I want to assess your spine. I'm going to go ahead and feel for the muscles, the paravertebral muscles along the spine. And then I'm going to go ahead and assess for pain. Do you have any pain?
No.
Okay. I'm going to tap along each of your spinal processes, assessing for pain. So you let me know if you have any discomfort. Any pain there? No? Okay. The next thing I'm going to do is I'm going to assess her shoulders, and I'm looking to make sure they're the same height. I'm going to assess for her muscles in her shoulders and asking if she has any pain. Any pain? No? All right, next I'm going to put my hands on top of your shoulders, and I want you to shrug up, and I'm testing her trapezius muscles here. Very good. All right, you can go ahead and relax. All right, go ahead and face me again, and we're going to go ahead and now assess for range of motion in her shoulders. So the first thing that we're going to do is we're going to go ahead and bring your arm forward, and this is called forward flexion. Very good. Now I'm going to have you do your other arm as well. Forward flexion. Good. The next thing that we're going to have you do is assess for hyperextension of your shoulders. So bringing your shoulders back. Very good. All right. The next two things we're going to assess for is abduction and adduction of her shoulders. So when we abduct, we're moving away from the body. When we adduct, we're adding the extremity back to the body. So let's go ahead and abduct away and then adduct back in. Very good. The next two things we're going to look at are internal and external rotation. So internal rotation is when we bring our shoulders back behind. This is also known as inside the cop car, internal rotation. And then external rotation, we're bringing our hands back above the head, which we refer to as outside the cop car. So external and internal. All right. Next, I'm going to go ahead and assess your arms for strength. Okay? So I'm going to have you go ahead and bring your arms forward, and I want you to push towards me. Very good. So we're assessing her deltoid muscle, we're assessing the biceps and the triceps. Now, I want you to pull my arms towards you. Very good. All right. As we move from our shoulders, we're going to go down to our elbows. And so we want to palpate and assess if there's any pain or discomfort in your elbows. Make sure there's no warmth or swelling. And then the next thing that we're going to do is we're going to assess for flexion of the elbow. So I'm going to have you bring it towards you. Very good. And then extension is bringing that elbow straight out. And we'll do the same for this side, flexion and extension. Very good. And then we also are going to assess for supination and pronation. So supination is bringing the hands up, palm up, and then pronation is bringing them down. So your palm is facing down with pronation. Very good. Next, we're going to move down to the hands. And so we're going to assess both the wrists and the hands together here. So we're looking for symmetry in the hands. As we go through, we are going to look for alignment of her digits. And we're also assessing for pain and swelling in each of her joints. So we're going to actually palpate each of her joints as we go through this. Any pain or discomfort as I palpate this? No. Very good. I want you to go ahead and give my fingers a little squeeze. I'm going to assess for strength. One more time. Very good. Next, we're going to go ahead and assess for range of motion of her fingers and her wrists. So when we assess the wrists, we're going to do hyperextension. So we're bringing the wrists back. Very good. And then we're going to assess for flexion of the wrists. Very good. And then finger flexion, we're going to flex our fingers, and then we're going to hyperextend our fingers. Very good. The next test we're going to do is our ulnar and radial deviation. So ulnar deviation is out and radial deviation is in. Very good. And then the next thing we're going to do is we're going to look at finger abduction and adduction. So abduction and adduction. Very good. Abduction, adduction. Finger extension and then thumb opposition is when we're going to go from our thumb to each of our fingers. Very good. All right. And then in that process, we were having thumb flexion, and then we're going to do thumb extension, where we bring our thumbs out. All right. Very good. All right. We're going to go ahead and move on to your lower body. So we're going to look at your hips, your knees, and then your feet. All right. So we're going to start with your hips, and I'm looking for symmetry. Both of her hips are even, equal. Any pain that you experience in your hips?
No.
No. Okay. So if it's okay, I'm going to have you go ahead and lie down on the bed. And the first thing that we're going to do is we're going to assess for hip flexion. So I'm going to go ahead and bring your leg up. And the motion of bringing this leg up right here is called hip flexion. And then bringing the knee down is knee flexion. All right, so let's go ahead and do that to your other leg. Hip flexion and knee flexion. Very good. And then we're going to go ahead and do hip flexion, leg extension. So hip flexion and then leg extension is bringing the leg out. Very good. Any pain with that? No. All right, hip flexion, leg extension. Very good. The other thing that we're going to do is we're going to look for internal and external rotation of the hip. So I'm going to go ahead and again flex your hip, And then we're going to do external rotation like that. Very good. And then internal rotation is the opposite direction. Any pain with that? No? And then we're going to go ahead and do the same with this. We're going to do the external rotation and the internal rotation. All right, you can go ahead and put that down. And then I'm going to have you go ahead and stand up one more time. And we're going to do hip abduction and adduction. So I want you 1 foot at a time to do the abduction where you're moving your foot out, and then adduction, bringing it back in, and then the same with your opposite leg. Abduction, adduction. Very good. Now I'm going to have you lay down prone, so with your stomach facing down, and we're going to assess hip hyperextension. So when we do hip hyperextension, we're going to hyperextend, meaning we're going to bring the leg up. So let's go ahead and bring your leg up. Any pain with that?
No.
Okay. We'll do this side as well. Any pain with that? No. No? Okay. That is a test that could be done standing or sitting. It's easiest to assess the strength in the legs when they're sitting. So I'm going to put my hand here, and I want you to lift this leg up. Very good. All right. Can you do that with this leg too? Very good. All right. You can go ahead and sit now on the side of the bed. And I'm going to go ahead and, so we've assessed, so that movement there was assessing the strength in your hips. And then we're also going to assess the strength in your lower extremities. So I'm going to look and assess, and her lower extremities are symmetrical. They're both the same size, and I'm going to go ahead and assess for strength. So I want you to go ahead and push up. Good, and push up here. Very good. All right, and then we're going to go ahead and assess her knees. So I'm going to go ahead and inspect. They both look the same size. I'm going to go ahead and palpate the knees, looking for any contour, and also asking the patient if she's having any pain. Did that hurt when I was palpating your knees?
Nope.
No. Okay, so then we're going to go ahead and assess flexion and extension of the knee. So go ahead and stand up one more time. You're getting your exercise today. All right, so when we do knee flexion, we're going to bend our knee, and then hyperextension is straightening it all the way out. Very good. Let's do the other one. Bend, and then hyperextension. Very good. All right, so for the remaining ones, we're going to assess your lower extremities and your feet. So you can go ahead and sit back down. All right, and so for this part, I'm not going to make Christina take her shoes off, but we're going to go through the exercises, and I'm going to verbalize them for you. So I'm going to inspect her feet, look at her toes, make sure that there's no abnormalities, no deformities at all, make sure everything is aligned, and then I'm going to palpate her ankles and her feet for contour and pain. Do you have any pain as I palpate?
No.
Good. All right, the next thing that we're going to do is we're going to assess range of motion in your feet. So we're going to do what's called dorsiflexion and plantar flexion. So dorsiflexion is bringing the feet up, just like she did, and then plantar flexion is pushing the feet down, okay? We're going to do inversion and eversion. So inversion, very good, is bringing them in. Eversion is bringing them out. So here we're assessing the range of motion in her ankles. We're also going to do abduction and adduction. So the adduction is bringing the ankles out like that, and adduction is bringing them back in. All right, and so additionally, we can assess flexion and extension of the toes, and then we're going to assess your ankle and your foot for strength as well. So I want you to go ahead and push down, very good, and pull back up. Very good, very good. All right, well, thank you so much for allowing me to do a musculoskeletal assessment on you.
Thank you.